Adara is now about 2 months into implementing our COVID-19 response plan, so we thought this was the perfect time to give you a bit of an update. When everything started to heat up with COVID-19, our team quickly realized that we needed to adapt our plan for 2020. And so we developed a COVID-19 response plan that has strategic goals, and all of these goals are informed by kind of 3 key principles.
Number 1, prevention for sure, like Hannah was saying, making sure that kids, women, children, senior citizens, everyone in the community, they know about the prevention measures and they follow it.
The second that is equally as important is ensuring that we continue to have access to essential services for communities. And then lastly, we want to make sure that all of the work that our team is doing and all of the protocols and training materials we're developing are benefiting other people outside of Adara. A lot of the plan has started to be implemented. I think the first area that's we're really proud of is that we've managed to get personal protective equipment to health workers in all of our programs across the world.
At national level, we worked with our network called Association of International NGOs in Nepal, and 21 of us came together and we agreed to buy PPE from China.
Equipment arrived from China that was then driven by the Adara team for 15 hours across the country, then put on another tiny plane, flown up into the mountains, up into the Himalayas, where it was put on the back of a mule and transported to the Adara office. And then our incredible health coordinator, Kiyama, travelled from village to village over the course of 2 weeks, delivering it to health facilities and conducting training.
I can remember one of the health workers from our project area, she was saying that she's a nurse. After lockdown for 2 months, there were a lot of people coming from outside, that's in homeland, and there's a risk of people coming from outside carrying COVID. And so the PPE that we delivered, it was right on time.
And the story in Uganda is almost as amazing. We had amazing donors step forward who worked hundreds of hours to get equipment to Chiwoko, working with suppliers in China, and now the health workers at Chiwoko Hospital are also protected.
A few days ago, I was chatting with some of the health workers and I asked them, what is keeping you going right now in this pandemic? They told me, for us, when we feel we are equipped with our PP, then we have the energy, we have the confidence to do our work well.
The second big highlight for us is that we have managed to launch our distance education program in the past couple of weeks. So across the world, there are millions of children out of school right now. Their education's been disrupted by COVID-19. We want to make sure they can still access education.
The data shows that when the kids are, away from school too long, then you really see the dropout rates are going up. We don't want to see that. We want to make sure the kids are engaged.
So in Humla, which is incredibly remote, the option for internet learning or Zoom classes isn't really there. So our team have launched a radio education program that's going to reach around 17,000 students across the district. There's 4 hours of classes every single day on 2 local radio stations covering maths, science, English and social studies. And I guess thirdly, another hugely exciting highlight from the past few weeks is the way that our hospital to home program in Uganda has managed to adapt to still support families in need. So this program follows up babies after their discharge from neonatal intensive care using volunteers in the community. And it's been amazing to see our volunteer community health workers transfer their skills to do phone assessments of babies where they can't reach them, or to just get on their bicycles and travel to homes even during a lockdown to make sure these babies are getting the care they need. One of the biggest things that's going to be important ahead is around nutrition. So again, the impacts of COVID-19 have impacted food in a really big way. For Adara, we are closely monitoring our communities and making sure that supply chains of food are still functioning, and where they're not, that we're providing emergency relief.
Do all these wonderful works. It's all because of the generous support from our partners, our donors, our friends. So without your support, we wouldn't be able to do all these works. We wouldn't be able to make difference. We wouldn't be able to do anything.
Our partners, friends, in any way you are doing, we ask that you continue to stand with us as we face this all together. Thank you so much.